Good afternoon, good evening, and good morning, wherever you are in the world. Welcome to another in the series of our Foresight Lectures. I'm very excited about today's lecture. Has a very interesting topic, which I'm pretty sure you'll all be very interested in listening to and gain an awful lot of insight from as well. But we'll get to that one in a second. Firstly, I'd like to welcome you from the Alpha Group. Now, the Alpha Group, if some of you don't know, is a peer-to-peer organization. And currently we're operating, believe it or not, in 33 countries around the world. Yeah, which is both good and bad. Simply because we want to be in all 200 countries around the world, and we've still got another 160 odd to go. So that's the bad part of it, I guess. But the good part is we're making great inroads into it. So what is the Alpha Group? Well, the Alpha Group helps business owners, particularly SMEs, the small, medium-sized enterprises, to raise the bar, to start that growth spurt that they need, especially coming out of the pandemic, which we've all experienced over the last 2.5 years. We're helping business owners now regain that vision, regain that desire, and find the reason why they started their businesses way back before the pandemic actually hit us. We make one promise to our members, one promise only, something we're very proud of because we've never failed to fulfill that promise, in that we will double the value of their business if they work with us for 2 to 3 years. If you would like to know more about the Alpha Group, I'm pretty sure you can find us in some of the emails and the bulletins that we've been sending out to you. Feel free to connect with me. I'll put my email into the chat box if you wanted to know any more information about the Alpha Group. Okay, so today's speaker, a wonderful lady from Bucharest in Romania, Oana Stanga. Before I hand over to Oana, and I'm sure she'll introduce herself far better than I can, I did happen to just check your LinkedIn profile, and there was something in there that just caught my eye, and I just thought I would share it with our audience today. Now, don't be too surprised, Oana, it's not going to shock you too much here. But it's a prayer that I think that you published at some stage, an old Irish prayer, which just kind of got me looking and got me thinking about it. So I'm just going to share it with our audience today. Take time to work. It is the price of success. Take time to meditate. It is the source of power. Take time to play. It is the secret of perpetual youth. Take time to read. It is the way to knowledge. Take time to be friendly. It is the road to happiness. Take time to laugh. It's the music of the soul. And take time to love and be loved. I think it's a wonderful, wonderful sentiment, Oana. And I'm going to steal it and share it with a lot of people in the future if I
Please do. Please do.
Fantastic. So without any further ado, Oana, I'm going to hand over to you. Ladies and gentlemen, just a little bit of housekeeping. If you have any questions for Oana, if we can leave them until the end of the presentation, and then I'm sure Oana will be happy to field any of those questions. Okay, you can just write them in the chat, and then we'll have a look at them at the end of the presentation. Oana, over to you.
Well, I will say just a few things about me, because people are here to listen to my presentation and to understand more about how to live a life of well-being and feel good about their own life and achievements. So I live in Bucharest. I'm psychologist, clinical psychologist, I'm psychotherapist, coach. I had an MBA and I spent almost 20 years in the corporate world. I started my coach training 12 years ago with Noble Manhattan. And this was my first step into the human development world, where I'm actually now, and I'm doing the job I love, and I'm living a life that I couldn't imagine it would be like this, but it was quite a journey. And let's start with the story of human optimization and how to achieve this well-being I'm talking about, and at the end, hopefully we'll have some interaction. Mental health optimizations in organization, it's about how you guys could function in the best possible way. Achieve that level of vitality that you enjoy each and every day. Well, mental health, it's quite a sensitive topic. And to be very honest, 12, 15 years ago, I wouldn't accept about myself that mental health is something for me. When I started as a coach, I thought, okay, coaching is for me because I'm powerful, because I'm strong, because I'm an achiever. And after I finish my training as a coach, I will be very smart to handle lots of things. But life offered me more chances that I couldn't even imagine at that certain moment. Feel fully alive. It's a motto. It's my essence. It's the way I act each and every day. And actually, all my journey was about achieving this kind of alignment between mind, body, and soul. It was a journey of reaching the security deep inside. Because actually, this is the end of a therapeutic process. This is something that we all aim for. Even if we know or not know, even if you are conscious or not conscious about. Achieving this secure feeling deep inside is actually the nice feeling of feeling at home. Once you feel secure, creativity and harmonious relations become part of your daily experience. You feel full-hearted, truly at home. Home is the place where you feel fully alive. It sounds a bit metaphorical, but actually in psychology, we call this home feeling psychological well-being. Yeah, when your soul is very well aligned with mind and body. Speaking about homes and life putting us at home. In March 2020, we all faced the same adverse event, no matter where we lived. And this adverse event actually has a strong impact on human development, no matter who we are, what we do, individuals, family, organizations face new challenges, and actually everything started in terms of behavior and cognition since then. We think and we act differently. For some of you, it was a time of growth. It was a time of adaptation to the new situation, a time of getting closer to the family, appreciating more life, reconsidering new life values, new small pleasures, a different lifestyle, healthy lifestyle, thought about community and growth and environment and embrace new possibilities. And actually, we look at technology as something that help us function, to help us work and educate. Since then, to make a small parenthesis, since that moment, I became 100% online therapist, and all my education was online since then. Actually, it was a time for some people of increasing personal strengths, resilience, and capacity to adapt. But these are the lucky ones, the ones who felt secure deep inside before the pandemic, before the COVID-19. They were able to achieve this kind of post-traumatic growth. For many people, vast majority, it was a time of distress. because an adverse event is perceived as a danger. And actually, bodies, that part of us who register, first of all, in our body, we have all our life story. And when we confront with an adverse event, we perceive the danger. And danger and mental health issues had different kind of names, from distress, which is the general word, to sleep disorders, Zoom fatigue, anxiety. Anxiety has different stages, and we'll talk very much in depth about anxiety, culminated with panic attacks, burnout, depression, psychosomatic pathologies, and we'll talk also about post-COVID obesity. We'll take most of these mental health issues one by one. Well, when I'm speaking about mental health, I'm speaking about that kind of disorders that once you manage to solve, you are able to function in an optimum way. That's the kind of mental health we will speak in this lecture. We will not speak about big psychiatric disorders, because you are a target group, you are a public, you are individuals able to function, able to work, able to have a life. So once you identify this kind of disorders and manage to sort them out, you'll achieve higher levels of vitality. That's a promise. When the Body Says No, it's the title of a famous book, but it's something that we have to incorporate in our life, to listen to the wisdom of the body, and to ask for assistance to doctors, but also to the psychotherapist. Because actually, when the physical body it's not in great shape, it's a sign that our soul, our self, it's not in good order. Let's take them one by one and I want to bring clarity about what is stress, what is anxiety, what is the burnout, what is depression. Because there are people who usually, when they don't feel okay, they say, I'm stressed. But actually, stress or distress encompasses a lot of pathologies, a lot of diagnostics, and it's good to be able to notice all these nuances. So when it's about stress, it's actually the body responds to a critical situation of pressure and critical events. It's about tension, it's about pressure, and it's about adaptation to this tension and pressure. Actually, when we are stressed, we are still able to regulate the stress. We do effort and we can improve the situation. It's a lot of theory about stress. It's a kind of positive stress, eustress, when you feel activated and you are able to achieve some goals and actually you perform. It's a kind of tension that you can have it in your body for a while, but you have to consider instruments to release this kind of tension. But still, simple stress, it's something that you should be able to handle. When I speak about burnout, which is a concept that we use very much into the corporate world, we speak actually about an occupational phenomenon or a syndrome. Actually, this is not a disease, but it's still a pre-stage of depression and anxiety. So it's not something that bad, but bad enough to give time and energy and work upon, because it's actually something serious. And actually, that's the result of prolonged exposure to chronic stress has 3 dimensions. We speak about exhaustion. We speak about mental distance and negative attitude towards work and decrease of professional efficiency. Actually, we feel so bad in our bodies that we don't like our work at all. We don't want to go to work. We want to have distance versus the work. It's something that requires attention and requires time for regeneration. It's something serious because World Health Organization included burnout in the international classification of diseases in the last book. And it's something that has negative effects on health. So if you don't treat it properly, it will evolve into depression and anxiety. There are some categories of higher risks, like doctors, nurses, or lawyers, bankers, I don't know, but probably it's a matter of how hard is your activity, how much you involve in your job. It's actually something that deserves to be treated and very much understood, because usually all these kind of diagnostics are like a portal into your self-development world, and it requires time and energy, but it deserves to do it. Anxiety. When it's about, I will talk about anxiety in general, because anxiety has a lot of forms and a lot of types. There are a lot of types of anxiety. Actually, it's a complex system of reaction, cognitive, emotional, physiological, behavioral, to a possible danger. It's an anticipative fear. So when we speak about anxiety, we speak about fear, about different levels of fear. Yes, the biggest fear is this panic attack. It's the fear of death. As I told you, there are different kinds of anxieties. We speak about, in general, about anxiety disorder, generalized anxiety disorders, but we can speak about OCD, we can speak about PTSD, post-traumatic stress, social anxiety. There are different types of anxiety, but it's about fear. And this kind of anxiety, to a certain point, it's okay to feel the fear. There is a certain level of healthy fear, yeah, because if you look into the evolution of us as human beings, fear had a positive role. The problem is when the anxiety exceeds the level of normal and gets into the pathological. That's the moment you need to ask for assistance. There are some people who have some genetic predisposition, which is called neuroticism. They are more anxious since the moment they were. Actually, the anxiety was passed through transgenerational. So, yeah, the mother was anxious, so probably somebody else in the family, but actually there are a lot of researches that show us that it's very important that the child, it's okay and it's in a safe place even from the moment it's conceived, yeah, in the mother uterus. So this kind of anxiety might be something genetic, might be something related to life experience. Yeah, the life experience had some episodes of high stress, trauma. And that's why anxiety, it's the modality to anticipate fear and control. It's a big focus on control. Stress accelerates and intensifies anxiety. So if the environment is charged with stress, all this anxiety gets to the higher levels. Yeah, we speak about this kind of panic. And panic, it comes with a lot of rumination and a lot of physiological symptoms, very powerful. Yeah, it looks very much like a cardiovascular disease. And actually patients go first to the cardiologist, try to find out if it's not something wrong with their hearts. And then they realize that it's a different story to approach. Depression. What an encompassing term. When we speak about depression, we can speak about a lot of symptoms and a lot of levels of symptoms. Yeah, because if anxiety is about fear, depression it's about sadness in general. It's about lack of energy. Yeah, anxiety it's with high energy. Depression is with lack of energy, sleep disorders, irritability, sadness. Yeah, and it comes from light to severe and persistent symptoms. Yeah, it becomes difficult to focus. You feel exhausted. You feel isolated. You don't have hope. And bigger depressions are with suicidal thoughts. And this is really hard to work with this kind of patients, because when life doesn't give you any reasons to enjoy, then it's a lot of work to do. And it's a lot of work from the patient side and the therapist side to make sure that life is great enough to live. As I told you at the beginning, post-pandemic physical shape, it's not the best. Okay, gyms were closed for a while, but people spend a lot of time in front of the computers. And we speak now about obesity at higher levels. And what is worrying is that also teens and young people are not in the best shape, are overweight, are obese. So 59% of adults are overweight or obese, both men and women. Out of 3 children is affected, is overweight or obese. And actually, when we speak about obesity, it's not only the aesthetic part, it's very much the health part, because obesity has a strong impact on health, cancer, respiratory disease, asthma, stroke, cardio disease, liver, kidney, mental health. So when the body it's not in a good shape, it's a good sign that you have to work on your soul, on your psychic, and understand deeper why you cannot take more care about yourself. So actually, obesity is very much related to food addiction. It's related to depression. It's related to anxiety. It's related to everything we saw before. As you notice, I went into this kind of health problems in a gradual manner. And I'm very fond on this topic of psychosomatizations, because cardiovascular, autoimmune, cancer, heart disease is very much related to the level of anxiety and depression. Actually, anxiety is a cause for this kind of somatizations. It's not the only one, but it's one of the factors. And it determines and is associated with this kind of medical problems. But what really matters indeed is that if somebody gets a diagnostic from these categories, it's also a moment to start and explore the life story. Because only when you own your life story 100%, body, mind, and soul, you can achieve the healing and the vitality and the good shape you deserve. Well, so far I talk about the body saying no, but actually the body could say also yes. And when the body says yes, it's about the body which has great energy. So healthy, integrated mind-body means you are able to live in the present and breathe. And you know who you are, and you have mental clarity. You are open and curious and capable to adapt, capable to self-regulate your emotions, your relations, first with yourself and then with the others. You have high levels of vitality, flow of energy. You are able to respond and not react. And this is what I call optimization. Well, what I put here on this slide, actually it's a whole therapeutic process, because when we speak about mind-body, integrated mind-body, this is the healthy, this is mental health, this is healthy psychic, this is what you can achieve during a process which includes a lot of types of therapeutical approaches, which includes thousands of hours of working with yourself. Because if you work with a coach or a therapist, you meet once a week. But it's very, very important what you do in the other 167 hours per week when you are alone. If you monitor yourself, if you are able to notice, if you are conscious about yourself, if you respond in an emotional way, or if you respond in a clear, rational way, or you react emotionally to situations. But once you achieve this level of optimization, you know. Because you don't feel tired, because you feel charged, you feel regenerated, you feel great, and you live in the present. And actually, this is something that I would be happy that more and more people would want to achieve. Because if you are parents, this is the greatest thing you can offer to your children. An optimized, conscious parent. Autonomy is also a word that I enjoy very much, and actually it's also the end of a therapeutic process. Being autonomous is knowing who you are, being on your own feet, or knowing exactly who you are, what's your purpose in your life. You are able to connect with other people, and you actually want to belong to organizations, but these organizations should be flexible ones. We as people, we have several needs, important needs. One is to be autonomous, to be competent, and to connect, to have great relations. Well, you probably are competent in your roles, in your life, in your professions, and this is something that requires other type of skills. But my role as a coach and therapist is to make people achieve this level of autonomy and understand what connection and belonging is. We are in a time when we speak about green organization. There's a famous book which is called, which is written by Frederic Laloux about organization, reinventing organizations. And he speaks about several types of organization. Red ones, which are like army, very structured, very rigid. Then other type of families, which like orange families, which are more like family of organization, which are more like families, family values, feeling good. Now we are in a stage when companies are developing into these green organizations. Green organizations includes this kind of autonomous people. Healthy, creative, innovative, who know who they are as individuals, but able to connect and to belong. And this work-life integration, it's the right concept, because before pandemic, we spoke a lot about work-life balance. But actually, when we look into the wheel of life, work, it's just an area, and there are a lot of other things which we call life, areas of interest. Work should be one area. We should be part of our life, but it's too much to say work and life should be in balance. Work should be integrated, and this is the correct wording, and I'm happy that now it's embrace it at certain level. There are some informations which I found when I documented for this presentation about this big challenge at worldwide level, which is called the Great Resignation. It's about a high number of people who intend to leave jobs during 2022 to the burnout, who want more flexibility regarding to where and when they work. So this word flexibility, it's also very much connected to autonomy, to stability, to security, because only a company with the flexible leaders can understand that this should be possible. Hybrid working from home, there are things we never thought before 2020. And now they are part of our normal life. And actually, people want to have a life and to have work in their lives, but want to have a life first. In Romania, data looks more or less the same. People look for opportunities and they want to feel good at work. And well-being became a real metric of success in these days, and I'm happy about it. So this is a time for great recalibration. Well, this is a very engineering-like word, recalibration. It's something very subtle and something very sophisticated, because these times requires sophisticated decision makers, real leaders, autonomous, aligned, flexible individuals, first of all, able to understand human natures, so how people act, function, and able to connect and to create this kind of flexible environments. That's why mental health should become a pillar for thriving organization. Yeah, thriving, it's another word that I love a lot. It's not sufficient to live, to have a life, to survive. It's very important to thrive in this lifetime we have. And actually, the companies who understand the role of mental health, and I'm happy to see more and more companies ready to hire, to have their own counselor, their own psychotherapist to work with the employee, because this is the kind of investment with huge return, short term, mid term, not we don't speak about long term. Companies who understand that, okay, technology, it's important, it's time of technology, but technology, it's just one pillar. Mental health and humans are the most important pillar. And creating stability, creative environments, innovation, vitality, team spirit. This is something that it's a must. It's not something nice to have. If they want companies who really want to exist for a while, they need to understand this. Basically, this is how a very simple schematic plan should look like. I'm a clinical psychologist, and I truly believe in the role of the evaluation. And actually, I'm working in this way, and I truly believe that my work is a scientific one. It's not something that I'm sensing. It's something that I'm seeing very clear with figures, with graphics, with real data. And the evaluation of anxiety, burnout, depression, level of stress, personality, autonomy, or way of thinking, all this data gives each and every person more insights about themselves in that moment. So for the companies with whom I work and I will work in the future, and evaluation should be the first step, because we have to know from where we start to be able to measure at the end the progress. Then I truly believe in counseling and coaching at the individual level. To make a confession, during the pandemic, I worked just one-to-one. I was therapist 100%, and I truly believe that every person is unique, and counseling and coaching one-to-one, it's very valuable. Then I believe that also there are types of information and insights that could be shared, stress management techniques or resilience, or what is work-life integration. Actually, when it's about workshops, group workshops at work, it should be in such a way that everybody should feel okay and confident and ready to participate and relevant. Last but not least, I will put this mindfulness, which is one of my favorite topics. I also had a research on mindfulness, and I truly believe that mindfulness is a very, very valuable tool, but it's not the first thing to start. It's probably the cherry on the cake. I'm practice yoga, I practice body art, I practice dance and a lot of conscious movement types. I'm not 100% into meditating 6 hours and staying and saying Sanskrit mantras. But I think mindfulness, it's part of any comprehensive work integration and mental health program. as I said at the beginning, my motto is feel fully alive. And everybody deserves to feel fully alive and integrate work as a personal contribution, not as a survival mean. Because once you feel good about yourself and about your contribution in this world, you look for healthy partnerships, you look for healthy relation in the family, and you look for organizations which are like your tribe and where you feel good. When you really start to embrace this well-being in your life, you don't go after the second best. Actually, we have the chance to be author of our life stories. And when you do a psychotherapeutical process, actually, this is what you do. You change your narrative and you re-author your life stories in a healthy manner. And that's the only way to become a human being able to act autonomously, connect and belong to community, to society, to organizations. That's my motto, and this is my evidence-based therapeutic approach, which I put together. I'm not saying I'm an inventor. I'm created something new from scratches, but based on the experience I had in the last years online, and especially with anxiety, stress, burnout, depression, I put together that kind of system, that kind of therapeutical approach that includes evaluation, psychotherapy, counseling, education, and mindfulness in such a way that we know when we start and when we finish, and we are able to measure the progress and understand how life changed. We can feel it, we can see it together, and we can measure the real success, because as I said, success these days means being healthy, 100% vital, living this well-being state and enjoying life. That's it. Hopefully it was relevant for you, and I'm glad to answer to any questions you have.
Oana, thank you very, very much. That was very mindful in all of its part. It makes us all think sometimes how delicate we can be if we don't take care of our health and our mental health, of course. Thank you very much for that. I do have a couple of questions from the audience. In fact, from Emma. The first one is, what role does diet play in managing anxiety, especially if you have a biological disposition?
Diet.
Mm-hmm.
I don't think there is any correlation between diet and anxiety. Probably a doctor will see, a nutritionist will try to sell this kind of insights, but I don't have. But actually, if you are on diet and you are able to keep the diet, it's a sign that you are starting to take care of yourself. So we speak anxiety, as I said, it's not bad per se. A certain level of anxiety, it's actually healthy, and it equals self-care. It's about taking care. It's about care in general. I'm caring a lot, and that's why I'm very much controlling things, but I'm caring. It's not something very, very bad. So anxiety, as I said, that's why I love this clinical part of my work, because I'm measuring exactly with real tools and tests and evaluations and everything. And I know, okay, this is a moderate, or this is a light anxiety, or this is a big anxiety. So this is something, as I told you, every concept has a different relevance for each person present here. And my anxiety is different than your anxiety.
Sort of different levels, I guess, as well.
Yeah.
Another one from Emma is lupus one of the autoimmune conditions that are associated with mental health issues?
Yeah, this is something I can speak. All this autoimmune disease, Hashimoto, lupus, whatever you speak about, it's about self-harming. It's about a mechanism in the psychic. So the person passed through a trauma, and the psychic split into three parts: a traumatic part, a survival part, and a healthy part. And actually the survival part is harming, self-harming. It's much more complex, the story, but it requires deep digging, because this kind of autoimmune are something that you can live with, that are chronic disease. But once you understand the story and understand to process it in a therapeutical process, profound process, the quality of life improves significantly, and you can live a long life, and the quality of life could be okay. But yes, this is connected to anxiety and to trauma.
Wonderful, thank you. And finally, there's a question here again from Emma. How does an owner of a startup manage his mental health so that he can manage his company to thrive, even if it does not grow?
Should look for, still look for something to find a way to collaborate with somebody to handle these aspects. First, to try to hire vital people, and I don't know, at least hire the right people, healthy, vital, and with a great mental health. I guess if you are in a startup, it's very important to start with the right persons.
Sure. Yeah, get it.
Yeah.
Thank you very much for that. Daniel, I'll answer this question for you. Yes, we will pass on the slide deck. I guess, Oana, that's okay to pass on the slide deck, yes?
Yeah.
Yep. So everyone who's registered here on the call today, we've obviously taken note, and we will send you a recording and the slide deck as well. So thank you very much, Daniel, for asking that. Okay, I think that's all the questions actually, Oana. So okay. I would like to say from Noble Manhattan, the Alpha Group, and from our audience today, a big thank you for that insight into something that we all are in danger of falling into. And it's good just to be able to watch the triggers, look after yourselves, both healthy wise and mentally wise as well. Thank you very much indeed. Wonderful presentation.
Thank you.
Take care, everybody, and mental health, keep an eye on it.
Keep an eye. We are powerful, but we are vulnerable as well, and we're fragile. Yeah, look for Sting song, Fragile. It's full of insights, and take care of yourself, because we have just one life.
Absolutely. Thank you very much, and thanks everybody else for attending today. Thank you. Gayan, you can stop the recording now.
Okay.
Thanks, Oana. We will